Welcome to Health Information System, ISH Med Clinical Module, SAP Navigation video. In this video, we're going to touch on SAP Navigation, which allows the user to be able to understand the SAP technologies and identify functions that the user will execute in their daily work. The following content is going to be covered: how to log on to SAP, clinical workstations, sessions and buttons, how to log off the SAP system. Our first section that we're going to touch in this video is how do we log on to the SAP system. To log on to the SAP system, we double click on the blue bird icon, SAP Business Client. When you have double clicked on the SAP logon icon, it will take you to the SAP NetWeaver login screen. You need to put your username and you need to put your password. After putting your password, then you need to click on log on. When you have logged on, it will take you to the landing page, of which on the landing page you got your frequently used frequently used transactions and your last used transaction, and you've got your work centers which you can be able to go to, and you've got your index section where you can open the index and you can open this SAP Easy Access. So to go onto the system, you need to click on the workstation. So after logging in onto the SAP system, the next thing that we'll have to do is to click on to the workstation, and the workstation will take us into the workstation environment, which is the next section that we're going to touch in this video. When you've opened up the workstation, it will take you to the clinical workstation, and depending with the authorization that a user has, you then be able to either access the clinical inpatient, or you will be able to access the theater manager workstation, and you can also be able to access the nurses workstation. Then if you are going to be a normal physician or any other clinician, you can then go onto the clinical workstation, which you can then be able to click on occupancy, or you can be able to click on transfer in, transfer out. Under occupancy, this is where you're going to see all the patients that are currently admitted in the facility. And on the transfer in, this is where you can be able to see the transfer movements. And in the transfer out, this is where you're going to be able to see any transfer out of the different particular wards. So for operations to do the clinical work, one has to go to the occupancy workstation. When the occupant workstation opens, one would need to be able to understand these particular buttons that are sitting on the occupancy. The first thing that one has to understand is this text that is written in bold, which is occupancy. It gives you the date which you're currently viewing and the time and the current patients that are currently admitted in that particular institution. And if you look at the bottom here, you'll be able to see the particular file number where they have been admitted, the particular room and the bed, the admission date, and their admission time. Then who's the attending physician, the name of the patient, and you'll also be able to see the patient number, the case number related to that particular patient, and you'll be able to see from here a view of the allergies if there are any. Currently here, if you see this lightning sign, it means there are allergies which are documented. And if you don't see anything, that means there is no data that has been captured on allergies. And also, you can be able to see risk factors. The moment you see an exclamation with a gold exclamation, then you'll be able to see that the risk factors exist. Then the classification of the patient, you'll be able to see it as well. So if you're going to be a clinician who's working in the surgery section, you'll be able to see your theater schedule, which is the scheduled surgeries and the current surgeries that are currently happening. And you'll also be able to go onto the theater grid where you'll be able to see the appointments of the surgeries that are scheduled. So if you go onto the theater schedule, you'll be able to see this theater schedule at the top. And currently, these are the available operating rooms. And what you can see there tells you operating room 1 up to 4 and up to 5, basically. And it also tells you the time, the duration. If there's a patient that has been operated, you to put the patient. And currently, you see that it's saying free, meaning that that particular operating room, there is no one that has been operated. And at the bottom here, you'll be able to see the particular surgeries initiated by the work list and whatever remaining surgeries that needs to be still taken or still need to be done by the surgeons. So all this is a list of the particular patients who are supposed to have their surgeries done at the moment. Then if you move on to the other workstation, which is the nurses workstation, in the nurses workstation, you've got also occupancy, where they can be able to see the occupants levels of the institution. And they also be able to see the nursing care plans, and they can also be able to see the nursing care pending performed. That means the nursing cares that needs to be performed. And they'll also be able to see the nursing care plans that have been performed or that has been cancelled. And over and above that, nurses can also be able to see any transfers in that have been for patients that have been transferred into a particular ward, and also the transfers out of that particular ward. So if you click on the occupancy of the nurses, you see that it also gives them this particular view that the doctors see. And from there, they can then be able to do particular things that are related to nursing. So as we move on, the next thing that we're going to touch on is the sessions and the particular buttons that are related to these particular workstations. So that's the next thing that we're going to touch on, which is what we're going to touch on now. And I will start with the nurses work environment. And from a nursing working environment, I'll start from the top and go into the bottom of these buttons. You see that these arrivals buttons It's a button that allows the toggling of on off of the transfers in. So if we click on it, you see that the view will basically change. Then you can see, based on this, it can then be able to show us the view of whatever patients that have been transferred into this particular ward or into the particular wards. And the patient profile allows the particular clinician to be able to view the particular patient profile. So the first thing is to highlight, and then you click on the patient profile. Then with find patient, this allows, if there is a long list here, you can be able to search for the particular patient. And also services, they can be able to see the services that are related to the patient. Case list, they can also be able to view the current case and the historical cases of the patient. Diagnosis, they're able to see the diagnosis of the patient. Display vitals, they are also able to display the vital values that have been measured. And here they can be able to enter the vital signs. And they can also be able to plan for vital signs with this particular button. Then this button, they can be able to create a clinical order for surgeries. And here they can also be able to view or edit all the physician orders. Then clinical documentation, if one needs to create a clinical documentation, then they can be able to create the clinical documentation. Then progress notes, this allows them to create progress notes if there are any progress notes that needs to be captured. Then you've got the nursing plan. This allows for the nurses to be able to create a nursing plan for a patient. Then here we've got the patient organizer. The patient organizer, if you click on it, you first highlight the patient, then you click on the patient organizer. You see that this gives all the related information regarding the patient. And as we can see here, it will tell us the historical activities that happened with the patient when the patient probably started to come to the facility, and it gives you a blow by blow, day by day here of what happened. And what we can see here, we can basically see that there have been some movements. There have been a surgery that has been scheduled on the 4th, and there are currently some services that have been added, a surgery, a clinical order that is there. And same here, you can be able to see their appointments or movement. There is a progress documentation that is there, and there's medical records that are there, and the vital signs that are there. So the patient organizer just gives you an overview of what probably has happened. And here on the side, this is basically navigation for filtering. If you want to see by the week, if you click by the week, then you'll find that the view will basically change, and it can cluster these activities by the week. If you want to do by the month, it will also be able to cluster them based on the month, and you can then be able to see. So this is just basically navigation. Then let me go back. Click that two green arrows facing the left to go back. So we have touched on the occupancy on the clinical workstation. Then you've got the nursing care. Under the nursing care, you also have things like patient profile, which we have touched on. And you also have, if you want to release a service, if you want to add a service, a nursing plan, you want to create, enter vital signs, progress notes, all these we have touched on them. Then we've got nursing care plans to perform. So if there are any nursing care plans that needs to be performed, then the particular nurse will have to highlight the patient if they exist here. Then they probably click on perform service, which is a button that allows them to say they've performed the service. And cancel service, this is where also they need to cancel the particular service that is part of the nursing cycle. So from here, they can also be able to see what has been performed. So currently, this is what has been performed. And on the status here, if you come on the status, you'll be able to see whatever that has got CL. It means that particular service has been cancelled. So for one reason or the other, that service might have been cancelled. So then we move on to the theater, which is for theater. And theater, we go to the theater schedule. And on the theater schedule, one thing that you'll be able to see is the surgery work list. And the surgery work list, if you click on it, it will give you two options, which is initiated surgery work list and remaining surgery work list. So if you click on initiate the surgery work list, if you do this, you find that it removes whatever that was here. Then whatever that has been initiated, that means it's stuff that is sitting on the theater schedule. So if there are any patients that are sitting on the theater schedule, then we'll be able to see only that. If we go back and if we choose on remaining surgery work list, then you'll be able to see that it brings back the remaining surgery work list. That means all the surgeries that still needs to be performed. Then creating a clinical work order, we have touched on that before, and also clinical order, we've touched on that, and this is to cancel surgery. So if for one reason or the other, the surgery cannot continue, then the clinicians will have to highlight the surgery that they want to cancel and then click on cancel surgery. Then specify team. This allows the clinician to be able to add the physicians or the clinicians that are supposed to be part of the surgery team. So this allows them to do that. And the set timestamps button allows them to be able to enter the preparation time and the time that the surgery started and the surgery ended. Then the create document, surgical document, this allows the clinicians to be able to create a surgery report document of what transpired in the surgery. Then you've got allergies, edit allergies and risk factors, which are some of the buttons that one can be able to touch. So I'm going to move on to the one for the general physicians. If you go to the occupancy, you'll be able to see that the other buttons we have already talked about them when we're touching on the nurses. You'll find that this is similar with the exception of this particular button, which is the delivery button. Delivery button will basically allow the clinician to be able to capture the baby's birth data. So that's the exception probably from the nurses and from the physician's workstation. So this brings an end to our navigation